Polycystic ovary syndrome, commonly known as PCOS, is one of the most prevalent hormonal disorders affecting people with ovaries, particularly during their reproductive years. Despite it being incredibly common, impacting approximately 1 in 10 individuals of reproductive age, it remains underdiagnosed, misunderstood, and often poorly managed. Understanding PCOS is essential, not only for those who live with it, but also for anyone seeking to support loved ones or learn more about reproductive and hormonal health. PCOS is a complex condition that affects how the ovaries function. The term polycystic refers to the presence of multiple small fluid-filled sacs or cysts on the ovaries. However, contrary to what the name suggests, not everyone with PCOS has these cysts, and their presence is not required for diagnosis. At its core, PCOS is a hormone imbalance. People with this condition typically have higher than normal levels of androgens, sometimes referred to as the male hormones, even though they are present in all sexes. This excess of androgens disrupts the normal hormonal feedback loop necessary for ovulation, the process by which an egg is released from the ovary. As a result, ovulation may be irregular or absent altogether, leading to missed or infrequent menstrual periods. The exact cause of PCOS is not entirely understood, but it is believed to be influenced by both genetic and environmental factors. Many individuals with PCOS have a family history of the condition, suggesting a genetic link. Hormonal regulation plays a central role, and elevated insulin levels appear to be a major contributing factor. Insulin resistance, where the body's cells become less responsive to insulin, occurs in many people with PCOS. In response, the body produces more insulin, which can increase the androgen production in the ovaries. This creates a feedback loop that further disrupts hormonal balance, leading to many of the symptoms associated with PCOS. The symptoms of PCOS can vary significantly from person to person, but some of the most common signs include irregular or missed periods, excess hair growth on the face, chest, or back, a condition known as hirsutism, acne, particularly on the face and upper body, thinning hair or hair loss on the scalp, weight gain or difficulty losing weight, darkening of the skin, especially around the neck or under the breasts, ovarian cysts visible via ultrasound, and difficulty conceiving due to irregular ovulation. Because these symptoms can mimic other health conditions, diagnosing PCOS can sometimes be delayed. A diagnosis is typically made based on a combination of symptoms, blood tests to measure hormone levels, and imaging such as ultrasound to check the ovaries. While PCOS is primarily known for its impact on reproductive health, its effects are far-reaching and can influence many other aspects of physical and mental well-being. From a reproductive standpoint, PCOS can make it more difficult to conceive due to irregular ovulation. However, it's important to understand that having PCOS does not mean a person is infertile. Many people with PCOS can conceive naturally or with medical assistance. Beyond fertility, PCOS is associated with several long-term health risks, including type 2 diabetes. Due to insulin resistance, individuals with PCOS are at a higher risk of developing diabetes. Cardiovascular disease, elevated blood pressure, cholesterol imbalances, and increased inflammation contribute to this risk. Endometrial cancer. Irregular periods can lead to a thickened uterine lining, increasing cancer risk over time. Obstructive sleep apnea, particularly in those who are overweight or obese. Mental health challenges. Many people with PCOS experience depression, anxiety, and poor body image due to both hormonal imbalances and the stress of managing the condition. While there is no current While there is currently no cure for PCOS, the condition can be managed effectively with a combination of lifestyle changes, medications, and supportive care. Lifestyle modifications are often the first step in managing PCOS. A balanced, nutritious diet and regular physical activity can help regulate insulin levels, improve hormonal balance, and support weight management. In fact, even modest weight loss around 5 to 10% of body weight can significantly improve symptoms and regulate menstrual cycles. Medical treatment depends on a person's symptoms and reproductive goals. Birth control pills are commonly prescribed to regulate menstrual cycles, reduce androgen levels, and manage symptoms like acne and excess hair. Metformin, a medication used to treat type 2 diabetes, is also frequently used to improve insulin sensitivity in people with PCOS. For those trying to conceive, fertility treatments such as ovulation-inducing medications may be recommended. Beyond physical treatments, it's important to address the emotional and psychological aspects of PCOS. Support groups, therapy, and education can empower individuals to better understand and cope with the condition, because symptoms can be emotionally distressing, especially when they impact appearance or fertility. Mental health support should be considered as an essential part of PCOS management. Living with PCOS can be a challenge, especially when symptoms are misunderstood or minimized. Many people with PCOS face stigma, frustration, and feelings of isolation, particularly when trying to navigate complex medical systems or societal expectations about appearance and fertility. But knowledge is power, and with a proper diagnosis, ongoing care, and lifestyle support, PCOS can be managed successfully. What's most important to remember is that PCOS is not your fault. It's a medical condition with biological causes, and you deserve support, respect, and access to treatments that work for you. Whether you're newly diagnosed or have been managing PCOS for years, you're not alone, and you have options.